Okay, so the topic that I picked for the solo presentation was breast cancer. And to start it off, I'm going to have a short clip that talks about it a little bit.
Breast cancer affects 1 in 8 women during their lives. Breast cancer kills more women in the United States than any cancer except lung cancer. No one knows why some women get breast cancer, but there are a number of risk factors. Risks that you cannot change include age. The chance of getting breast cancer rises as a woman gets older. Genes. There are 2 genes, BRCA1 and BRCA2, that greatly increase the risk. Women who have family members with breast or ovarian cancer may wish to be tested. Personal factors, beginning periods before age 12 or going through menopause after age 55.
Other risks include being overweight, using hormone replacement therapy, also called menopausal hormone therapy, taking birth control pills, drinking alcohol, not.
Okay, so these are just some of the basics. This is also part of what I talked about in my PowerPoint presentation. So the first thing that I want to talk about is the symptoms. A lot of women don't know that they have breast cancer. Oftentimes they'll go in just for a screening or something and find out that they do. So some of those are that people have lumps in their breasts and thickening of the tissue. And so that's the easiest sign to figure out that you have it. Some of it is change in size, shape, or appearance of your breast. So if that's going on, then you might want to consult your doctor. Redness around the breast can be a sign of it, but that can be a sign of a lot of other things, so people often confuse it. Or dimpling or changes of the breast tissue. So the next thing I want to talk about is risk factors. Obviously, females are at a higher risk for this than males are, so they are the ones that go for yearly checkups. A huge thing that plays a role in getting breast cancer is your family genetics. So oftentimes, if someone in your family's had it, you're way more likely to get it as well. Like I said in the video earlier, there's certain genes that you carry, like the traits that you have. They're gene mutations that are associated with breast cancer. So people find out their genes, and they often will know that they need to get checked more often for breast cancer. And another one that is environmental is large exposures to radiation as a child. So this can be just UV rays, but it also can be like getting a lot of x-rays, MRIs, things like that. So the big thing I want to talk about is prevention and what to do when you think you might have it. So the first thing is to see your doctor regularly. Women are supposed to go for a yearly checkup about every year. So if you think you're more susceptible to it, maybe going every 6 months would be a good way to prevent it. Another thing is that women don't often know how to practice properly breast exams at home. So consult with your doctor on the proper ways you should be checking your own self each and every day to make sure that it doesn't get to a point where it could kill you. Another one that I found interesting is drinking alcohol in moderation. This just helps keep your tissues healthy and does all of that. So drinking in moderation is a huge part of preventing breast cancer. And another one is maintaining a healthy diet and weight, which seems like everyone always says that, but this is the best way for your body to stay healthy. So it's important to have a good diet and work out regularly and all that stuff. So another thing that I found interesting is there's almost nobody that hasn't had someone affected by breast cancer. So meaning everyone in someone's family usually has known somebody or their relative has had it. So I think it's just really an important topic, and I selected it because my grandma had breast cancer twice and she fought it off twice. I just think that's so incredible, and I think that the better we can prevent it and show the symptoms and let people know what they should be doing, the less likely people are to die from it. And women should just look out for each other And I think this is a good way to learn to prevent it and the symptoms, so you can go see your doctor if necessary.